How to categorize the severity of physiological status for the breathing section of the Prem triangle. This is based on evaluation of 4 parameters: the respiratory rate, grunt, retractions, and the pattern of respiration, whether thoracic or abdominal. If the respiratory rate is normal for age, no grunt, no retractions, and the pattern of breathing is thoracic, we infer that the breathing is normal. If the respiratory rate is increased for age, there is no grunt, no retractions, the pattern of breathing is thoracic, then we infer that the child is having effortless tachypnea, perhaps due to underlying metabolic acidosis. If the respiratory rate is increased, there is no grunt, there are retractions, and the pattern of respiration is still thoracic, consider respiratory distress. If the respiratory rate is increased or normal for age, relative bradypnea, or the child has developed a grunt, retractions, and abdominal pattern of respiration, consider impending respiratory failure. If, when you place your hands, there is no breathing effort, grunt, retractions, and the pattern of respiration will be absent in such a situation, consider the diagnosis of apnea. How to recognize relative bradypnea? When a child is brought with history of fever, diarrhea, or breathlessness, if the mother reports that her child has developed lethargy or incessant cry or is not as usual or excessive sleepiness, that is the line history, we presume that the child has become either hypoxic or shocked, and we expect the respiratory rate to have increased for that age, which means the child has tachypnea. But the respiratory rate is now falling to the normal range and therefore is likely to be relative bradypnea. We confirm this by using the second step: perform or recognize the physiological status using the Prem triangle. If the other parts of the triangle are normal, that is, the child is alert, mother denies altered level of consciousness, the airway is stable, the circulation is normal, then this respiratory rate, which is normal, is normal, true normal. If the child has profound loss of level of consciousness, the airway might be unstable, and the child is in shock, this normal respiratory rate is relative bradypnea. The breathing part of the triangle: breathing normal, effortless tachypnea, respiratory distress, impending respiratory failure, relative bradypnea, or apnea.